Hello everyone, welcome back to my channel. In today's video, I am going to show you all how to use the PenRad charting system in mammography. This can also be used for breast ultrasound as well because a lot of breast ultrasound techs, we use the charting system for PenRad whenever patients come in and they have like a certain symptom. So this will be used for both texts. Also, if you are a mammography student, let me know in the comment box if you have seen the technologists use this whenever you are in clinical. Also, if you are mammography or breast ultrasound tech, let me know if this is something that you use. So this is how the page will look after you have gotten into like the patient's name. So because of HIPAA, I cannot show that screen. But when you first log into PenRad, you have to put like your username or password. Then you'll select that you are a technologist. You will pick the location you work at. I cannot show that either because it had other tech names on there as well and the location. But you'll choose yourself, and then whenever you get into PenRad, you would click on exams to start the exams, where it has like the patient information. Click on whatever patient that you are trying to start. And then after you click into it, this information will come up. So whenever you get to this page, this is pretty much like the first page where you are going to indicate like if a patient is having any type of problems with their breast. If they are, for a screening mammogram, they cannot be done if they have like a lump. If they have like a lump or any type of problems where it's supposed to be a diagnostic, you cannot like chart on it for that reason, like for a screening, but you can put things in as far as the patient has a tattoo. So whenever you see if a patient has a tattoo, you can click tattoo, and then on the breast, let me highlight it for you. On the actual breast, you can put like the tattoo is right here on the patient's breast. And this can keep you from guessing or saying the patient has a tattoo at this part or that part. You're actually seeing it on the breast and you're correlating to this picture right here. If a patient has, let's say, a lump, you can select lump, and then you can put the lump like right here somewhere. If the patient say they have a lump on their left breast, if the patient say they have pain, pain is going to be on the first row. You'll see pain, and then you'll click on the chart where the patient saying their pain is at. So if they say their pain is at on the right breast at, let's say, 3 o'clock, that's where you'll put the pain marker. And then you also have like your reduction marker, your implant scar marker, where you can put where the patient states they have those problems as well. So if the patient has a pacemaker or something that you do not see right here, that's when you'll go in and you'll select user defined. Whenever you select that, it gives you more options. Like you can put pacemaker, you can put defibrillator, you can put anything. You can even free type something in, but make sure that it is spelled correctly if you are free typing. Okay, so after you have finished that, this will pop up, and whenever it pops up, this is the information that you have to put in order to track the patient's TC life score, which is at the bottom by my face. You'll see where it say TC life, and it gives like a percentage. That percentage at my clinic, I'm just saying for my clinic, it could be different everywhere else. But at my clinic, that percentage, if it's above 20%, we have to let the patient know that they may get a call back from the high risk clinic, because this information has to be accurate because it's going to determine a patient's risk for getting breast cancer based off of this information. So you'll have your patient. Normally, if you work at a place where the iPad is connected to this system, it gets connected to our PenRad charting system and it's already filled out. but sometimes you have to still double check, especially if the patient has been there 10 times and someone forgot to give them the iPad or no one updated. You still need to make sure that this information is accurate. I know there are a lot of times where patients is trying to put in their pounds, and instead of it putting in 171 pounds, it may put in 71 pounds. So you always have to just double check with your patients. So starting from the top where it say, let's start with menstruation. So for the first menstruation, we all know that's important. You'll put in their age. For the children that they have given birth to, put how many children. This patient, it was 0. For an example, breastfed 0. But if they have had any births, where you see value selector, where the little bar is at, plus and minus bar, you cannot type in numbers in PenRad. You will have to either click the plus button to go to have more numbers, or you have to click the minus button to have less numbers. It will not let you free type numbers on this page. So, and then you'll go down to what age the patient, if they did have kids. Under administration, you'll put their first pregnancy, you'll put the age or the year of the first pregnancy, and then you'll put the age of the year or the year of the last pregnancy if they had more than one child. For breastfeeding, once again, you have to hit the plus or the minus button to put in the numbers, and also for the numbers if they did breastfeed, put in their menopause age. If they're premenopausal, that's when you'll go to that far column where it say risk factors, and you can check where it's blue, highlighted in blue, and it say premenopause. You can check that. You can check perimenopause. You can check postmenopausal. Put in if they've had a hysterectomy, what age or year. If they've only had a partial hysterectomy where the ovaries will stay where it stayed with them, you do not have to put ovaries removed because the ovaries wasn't removed. Just put the age or the year they had a hysterectomy. But if the ovaries were removed, then you'll put the age the ovary were removed. Make sure that their height and weight is correct. You also want to put in hormonal contraceptives, whenever it started, the last time they used it, how long they used it for, like this information right here. Also, estrogen, progesterone, tamoxifen, and then whenever you are saving this information, you can click update um, off to the side to the right. Then make sure that you have their menstrual cycle accurate. Put in when they have a menstrual cycle. Check if they are pregnant or not. This is important, um, especially for the implants. Pregnancy is important, but especially for the implants, make sure that you are checking that the patient has implants so that it can alert the next tech, which they should also be looking at the previous mammogram, but that doesn't always matter because someone may have had a mammogram in June of 2024 and went and got breast implants in April 2025. Now they are due for another mammogram in June 2025. So you can't always go by the last images. So just make sure that you always click in update frequently to save the answers. If the patient does not have family history of breast cancer, then you put no family history. You select that on the side. If the patient has never had a child, like this patient, you will put newly porous, never pregnant. You'll click that. If the patient have had family history of breast cancer or ovarian cancer or a genetic test, that's when you'll add it where it's a relation, date of birth, year, age, died age. So for relations, it gives you several options. Since this one didn't have like family history, it didn't give me that option. But if you have to add someone, it gives you like mom, maternal aunt, paternal aunt, sister, paternal grandmother, maternal grandmother. It gives you all that information. I think it even gives like father, uncle, because men can get breast cancer too. So, and then off to the side, you can also put personal breast cancer history if a patient has had breast cancer. And then you can put history of, gynecology, cancer elsewhere. If you put cancer elsewhere, make sure under notes at the bottom that you put what kind of cancer that the patient had. And then it's just other information that's very important. You can select the BRCA cancer gene. You can select that if it was positive for their genetic test. You can also put if the patient has gained or lost weight. You can select these buttons on the side. So that's it for this page. If you have any questions, let me know. Whenever you are done with this, you can hit OK, which is at the very bottom. Or if you want to back out of it, you hit cancel. For notes, you can click notes at the bottom. Then you can just free type in different notes like limited study due to patient in a wheelchair, limited study due to patient unable to hold still due to Parkinson's. With Parkinson's disease, some patients cannot hold still. A lot of them, can, but I'm just saying, for instance, if someone cannot, and then you can put patient had breast implants removed. So these are different examples you can add under notes. Patient unable to tolerate adequate amount of compression or positioning. So for the next screen that you'll go to, and sorry if I have to jump and skip to different things, because whenever you see your PenRad, you'll probably see just a tad bit more information, but that's because of HIPAA. So I couldn't show a lot of things, but this is like the bulk of what you need to know. This will help you navigate through any PenRad system by you watching this. So if a patient was coming in for a screening mammogram, but it's their first one, PenRad gives you a lot of different options because when text or free typing, we tend or we can make a mistake whenever we are typing in what we're trying to say. So for this, where it's a clinical text, the patient is here for a baseline screening mammogram. This is already selected. These are things that's already in the system that someone just put in and generated for us text so that we do not make mistakes. Because this information right here is going on the radiologist report for the patient. Then the radiologist, they do double check and they annotate what they have to put in as well. But for the most part, for the clinical text, clinical history, whatever is in here is what's going to be on the patient's final report. So you have different options off to the side where say phrase categories, you have screening, your recall, mammo or ultrasound where screening was done or an exam was done, the patient have to be called back. Then you have if the patient's having symptoms, if it's a follow-up, cyst aspirations, guide wire, drainage. It's a lot of things under this category. Breast surgery, family history of breast cancer or other cancers. You have implants. You have initial imaging, limited study due to compression, follow-up routine, drainage procedure. It's a lot of information under this section. And then at the very bottom, we'll focus more. Let me highlight it for you. We'll focus more on this area right here at the bottom. So at the bottom, whenever you first get into this screen, I always click on import clinical, and it's hot. Everything that I'm focusing on now is highlighted in yellow. I always click on import clinical. So when you click on this, it brings up the previous history that another tech put in, and it probably is going to give you more information versus if you didn't ask all the questions that you should have asked because you forgot something. Import clinical will sometimes it'll give you a lot of information. Sometimes someone forget to put in things. Different facilities where you work at, especially if you're documenting implants, they like to see patients have bilateral implants. Um, they like to see that the pushbacks was performed. So you have to put information in like that, the displacement views. So sometimes I see displacement views were performed, sometimes I do not see that. So going to import clinical should be the first thing you do. And then once you see that the patient have not had any imaging, then you can select one of these um, columns or tabs And then for clinical text, sometimes if it has other things already typed into it, just erase out of it and then select one of these. And then the next thing I click under what I have highlighted, I either click OK or cancel. And that's it. And then I go on to the next page. So when the patient does come in and they have different symptoms, this can be for mammo text or breast ultrasound text. You want to put why the patient is coming, like what findings, what did the patient tell you, what did their doctor tell them. So this is where you can put the patient stage they have a lump, or she has a lump in the right breast or the left breast, or if you palpate the lump, or if the lump is found in the axilla, or if the patient has bilateral lumps. All of this information is right here pretty much pre-selected for you to choose so that you are not free typing. And then this is more information. You can click on one of these. You can only click on one at a time. So whatever you click on, make sure it's the correct breast and the correct area, because you can only select one of these findings. And this is if the patient tell you that they have breast pain, if it comes and goes, if the pain is constant and the pain is staying there in their right breast or their left breast, or if it's around their menstrual cycles, if it's in their axilla. These are information that you can just pre-select if it's one breast, if it's both breasts, which is bilateral. And then you have more findings where you can select if a patient has had a breast biopsy. This is very important whenever you are doing your clinical notes. Put if the patient has had a benign biopsy, which breast it was. Was it both breasts? Was it one breast? Tell which breast it was, right or left. If the patient has had bilateral breast lifts or breast reduction, that's very important, especially if scarring is notified in the breast. You don't want the radiologist thinking that is asymmetric tissue and they call them back. If they see that the patient has had breast reduction surgery or breast lift, they can link it and correlate it to scarring due to the surgery. And then also put if the patient has had multiple biopsies. And then if a patient has to come back because let's say this is for breast ultrasound text, you can put the sonography was performed to evaluate mammography abnormality, to evaluate a lump. This sounds like what a radiologist would put in their notes, but this is how that we are charting at the facilities that I have gone to with Mammo. We're using PenRad. These information is already put in, and then of course the radiologist is going to double check, because there has been a time where someone had put in there was a problem on the left side, but that really was a problem on the right side. So we have more information for breast ultrasound techs. Also put in the comment box if you are a mammo tech watching this video, if you are a breast ultrasound tech watching it, or if you are a student that's watching this video and you're just trying to learn, get ahead in clinic because you're watching the text and you don't know what they're doing, because that was me. The text was like clicking on things, but they wanted me to mainly focus on the patient care aspect of it instead of charting. So whenever ultrasound has to be done, the sonographers will put in or click the exam was performed due to bilateral pain or pain in the right breast or the left breast. And then you have whenever a patient has had like a lumpectomy or radiation to their breast. This is very important. It gives a lot of information. It states the patient has had a lumpectomy of the right or the left breast due to a personal history of breast cancer. That's when you go in and you put that they've had radiation to whatever breast if they have, or they've had chemo. So all of this is important as well. And then this is extremely important. All of this is important, but this determines why the breast, whenever you are in mammo, why the breast is not, you do not have like a good IMF picture, why your compression pounds is at 6, and the radiologist or someone is wondering why you couldn't compress 15 pounds or 20 pounds on this patient. And that's whenever you put the patient could not tolerate full compression, which is going to slightly limit the exam. Or you can put the patient cannot tolerate adequate positioning. You can even put the patient is kyphotic, which their back is humped. That's why they can tolerate the positioning. And then if a patient was recalled, there are several reasons, and this is a recall because additional images needed due to a mammography abnormality, or recent callback for additional sonography imaging due to abnormalities seen on the screening mammogram, or if the patient has come back due to a technical issue such as, let's say, a machine problem, tech repeat. Then this is more information about a patient is having a lump in their right breast or their left breast. And if I'm going too fast, you can just pause it and or rewind it. And if you are not using PenRad, you can feel free to let me know if you are using paper, if you are using another charting system. I've only used PenRad. I have not even used paper whenever I am doing the patient care clinical history for mammo or breast ultrasound, because I do work in both. But you also can put in your 6-month follow-up. The reasons why is it because of a core biopsy, they need another ultrasound, mammography abnormality, stereotactic biopsy that they had 6 months ago. This is just a follow-up. And even if you do not use PenRad charting system, let's say you're just using paper or you're free typing this information in, you can always come back to the video and just copy what this information is saying. It really makes you look more professional and makes you look like you know what you're talking about if the information is typed out like this versus you're guessing or you're putting in like words or misspellings, So I would say you can always come back to the video and just write this information down, or just take some of this information and then just copy it to your charting system. And then if a patient has a pacemaker, this is very important. It can show why the exam was limited. So limited because a left-sided pacemaker or a defibrillator. So this would go on the patient's report and it will let their doctor know. Also, if inspection comes back and someone is wondering why they took images of this, or why was enough compression on this side versus that side, and this is why. So that's it for this video. I hope you all enjoyed it. If you're wondering who are these people and why they are on this screen, this is my shout out page. I do mammography registry review videos. These ladies use my videos and they passed their registry on the first try. So shout out to them. One of them took their registry exam in May of 2025. Another one took their registry in June of 2025. This month that we're in now is July. Today is July 6, 2025. So I always like to shout out these ladies. I want to just throw in this PenRad video to see if anyone has used it. If you haven't used it, hopefully you can find this video helpful. I wish I could have showed more, but of course, due to HIPAA, there's only certain things that I can show you. You can also view prior images in this PenRad charting system. You can pull over prior images for the radiologist to compare the images to. You can even view the report. So it's other things you can select. Also for ultrasound text too. I just couldn't get to it because of the HIPAA law. But other than that, if you enjoyed this video and you found it to be helpful, please give it a thumbs up. Check out my Mammo Registry Review playlist if you are a Mammo student, or even if you are a Mammo tech, you can use this for your CQR. Thank you all for watching, and bye.